Good morning, everyone, and a warm welcome to you all. Thank you so much for joining us at this Family Hub's Evaluation Innovation Fund webinar. It's brilliant to see so many of you here this morning. I'm Bronya Arnott, Regional Implementation Advisor at the National Centre for Family Hubs. Closed captions will be available during the webinar. Please click on the Closed Captions button to enable these. This can be found at the bottom of your screen. The chat function is disabled during this webinar today. If you have any questions, please submit them via the Q&A function. That can also be found at the bottom of the screen. There is also the opportunity to upvote any questions. All the slides from the presentations today will be available after the event and shared with you. And the webinar is being recorded today and will be available on our YouTube channel in the coming weeks. If you have any technical issues, please put these in the Q&A function and a member of the training and events team will be able to assist you. So for anyone joining us today for the first time, the National Centre for Family Hubs is an online resource hub and learning network that is funded by the Department for Education and led by Anna Freud, the UK's leading evidence-based children and families mental health charity. The National Centre for Family Hubs is designed to support the development and implementation of family hubs and to spread best practice, taking into account what families say they want and need, what providers tell us about what works in practice, and what we know from evidence about what works. Next slide, please. So today's webinar is part of a rolling programme of learning events hosted by the National Centre for Family Hubs, and recordings and resources from all of our previous events are available on our website. We have some upcoming events as well. On the 15th of February, the National Centre for Family Hubs induction session is being held. This session will provide you with an overview of the National Centre for Family Hubs, including national policy context and our approach to working with local authorities across the country. If you'd like to book onto this event or any of our future events, then a link will be posted in the chat function for you. You can also join our Family Hubs in Mind learning network to receive our newsletter. There we'll share details of future learning events and other resources of relevance to family hubs. And you can also contact us directly via our inquiries inbox if you have any questions at all. So moving on to the next slide. Today's event will be exploring the findings from the Department for Education Family Hubs Evaluation Innovation Fund. Sheffield Hallam University and Ecorys partnership were commissioned to deliver a programme of research working with 6 local authorities across England. Understanding what works in terms of family hubs is important to inform their development and implementation, and it's also important to consider what provides value for money. The evaluations were conducted, explored different family hub models and at different stages of maturity, and therefore we hope there will be learning for everyone. This learning event will share the main findings from the completed evaluations, focusing on impact and economic evaluation. So we are joined by a brilliant lineup of speakers today to explore this topic. We are going to be starting with a presentation from Sheffield Hallam colleagues. We will then be joined by colleagues from Ecorys, and we will move on to a panel session with some of the local areas who've been involved in the evaluations. We will then have a Q&A session with all of our speakers joining before bringing the event to a close at 11:30. So if during our session you have any questions or comments, please do put them in the Q&A and we will try and bring these into the discussion this morning where possible. If we don't get to all of your questions today, we will be collating a list of frequently asked questions which we can share after the event. So I'd now like to welcome colleagues from Sheffield Hallam University. We have Professor Mike Caldwell, Associate Director of Research and Innovation at Sheffield Hallam, and Professor Ian Wilson, Deputy Director at the Centre of Regional and Economic and Social Research, joining us this morning. So Ian and Michael, a warm welcome to you both.
Thanks very much, Bronya. Can I just check that you can see the slideshow?
You can, yes.
Great, fantastic. Welcome everybody, and thanks ever so much, Bronya, and to the Anna Freud Centre for hosting this event. So our presentation focuses, as you can see, on our evaluation work with the City of Doncaster Council. So in this session, we'll just give a very brief introduction to the aims of the evaluation and the Doncaster model, and then our evaluation is focused mainly on the impact evaluation. Some of you will have been in a previous presentation webinar like this, where we talked a bit more about the IPE, but there will be opportunities for us to the implementation and performance evaluation. There will be opportunities to discuss that more later on in the Q&A. So both of our studies, the Ecorys study and the Sheffield Hallam study, aim to evaluate the service implementation and performance, the outcomes and impacts and value for money. In our case, we were working really closely with colleagues from City of Doncaster Council, looking at their family hubs model. This is a little map of Doncaster. Doesn't include all of the family hubs on it, but we've got a large local authority, quite disparate in its geographical and various other ways. And it's key to the model that they use that they have a 4-locality model. So that involves organising the family hubs delivery across 4 different areas within the authority, and we'll come back to that a little bit later on. And the model provides a range of different services. This is a visual representation which Doncaster have used for some time now. I think they've developed it a bit just to give a sense of what the focus is from birth to or pre-birth to 18 and beyond, and an umbrella for a whole host of services, particularly focused on a core for the under 5s and then an extended model for older children, young people and carers. And I'm going to move on now to hand over to my colleague Ian Wilson, who's going to take you through, first of all, the impact evaluation methods, and then he'll talk about the findings. Over to you, Ian.
Cheers, Mike. And yeah, just to reiterate, thanks for inviting us today. So I'm going to provide a brief key findings from the impact evaluation and an cost analysis for Doncaster's family hubs. And then I'll hand back at the end. I think Mike's going to briefly go over some conclusions and some implications. So on this slide, I just want to start by briefly outlining the approach. I'll have a lot more details obviously provided in the report. Now, if you want further information, we can either pick it up in the questions and answer at the end, or I'd point you in the direction of the report. So in terms of assessing the impact, our main primary approach was a quasi-experimental approach, which was designed to provide a high level of kind of rigor to support and really provide strong evidence for the family hubs over and above what you might have expected to happen without the family hubs. And we did this for outcomes which we could access, but also ones which were appropriate for Doncaster's, the model in Doncaster, which was actually quite predominantly focused in this early phase on early years outcomes and prenatal support. So it's quite a complex analysis of what we've done, and it goes into detail in the report. So there's a range of sort of methodological requirements and challenges. So what I'd say, if anyone is interested in replicating the approach, please do see the report, but understand that some bits are a bit more complex than others to do, and it needs quite a lot of data requirements on behalf of the council and family hubs models. So primary analysis took place at a family hub user level, and it used administrative education data from Doncaster, which is provided by Doncaster, on its own pupils, as well as pupils outside of Doncaster from the Department for Education's National Pupil Database. And basically involved 2 parts. The first part was to identify matched comparator samples for pupils in Doncaster's family hubs against those who are statistically similar from 2 comparison groups. The first were pupils from outside of Doncaster in Doncaster's 8 statistical neighbourhood local authorities who have no family hubs model. And the second group were pupils who live in Doncaster but did not attend one of the family hubs services. In many ways, there's potential biases with each, which we explain in the report. I don't want to get too bogged down with it now, but for the results presented today, we're focusing on Doncaster's statistical neighbours, as we think they provide a best estimate of the likely impact, because it allows for the kind of wider system level impact of family hubs. But again, more discussion about that is in the report. And the main assumption, because of our analysis, is that because the populations of young people who are comparing are similar across a range of characteristics, any difference can therefore be attributed to the family hubs. So once we've established the samples, we then conducted statistical analysis to estimate and test the difference in education outcomes. And we particularly focus on 2 outcomes, which related to early years, more to early years. The first is achieving a good level of development in early years foundation stage profiles. And the second is meeting the expected standard in a phonics screening check at the end of year 1 at school. So whilst there's only 2 outcomes and it's very education focused, it actually related quite strongly to the family hub activity to date in Doncaster. The impact analysis also, and I'll briefly provide findings from a survey of parents and families, which provided perceptions of outcomes. And we also had data from administrative family hub data on attendances, which was collected by Doncaster. Do you go to the next slide, Mike, please? Cheers. Next one as well, sorry. Cheers, thank you. So we'll start by focusing on the educational impact. So it's the quasi-experimental approach. And this basically considered the results of pupils in their early years foundation stage profile and year 1 phonic outcomes. And it considered 4 assessments taken between 2017 and 2022. Which covered the period since Doncaster's family hubs were established. There's obviously only, even though it covers 6 years, there's actually only 4 assessments because there's no assessments in 2021 because of COVID. And when we did the analysis, we identified a statistically significant effect associated with participation in the family hubs activities for both outcomes. So EYFF attending a good level of development and phonics year 1 assessment, and against both of the comparator groups. Focusing on equivalent pupils in Doncaster statistical neighbours, we identified pupils with 1.6 times more likely to attain a good level of development in their EYFSP assessment. So what this roughly works out is for every 1,000 pupils who attended a family hubs and took part in assessment, 39 pupils achieved a good level of development who wouldn't have done so if they hadn't attended the family hub. In terms of the phonics year 1 assessment, pupils were 1.02 times more likely to be working at the expected level, which translates to an extra 17 pupils attaining this level for every 1,000 pupils who attended a family hub and took part in assessment. I'm now going to go on to explain a few bits of sub-analysis, which tries to understand this in a bit more detail. So the first bit compared the impact of the family hubs over time. And what it revealed is that actually the estimated impact of pupils taking the EYFSP assessment was statistically significantly higher in 2022 compared to the 3 assessments taken between 2017 and 2019. In 2022, family hubs pupils were 1.09 times more likely to achieve a good level of development, compared to only 1.05 times for the assessments taken between 2017 and 2019. A similar kind of sizable difference was identified for phonics assessments. However, it wasn't statistically significant at this stage, but may emerge to be significant in future years as the samples are larger. The explanation for this larger impact we've hypothesized, but I think we need more research, is to do with enhanced support that was provided during COVID by the family hubs, the kind of the maturity of the family hubs model in the first 3 years. Obviously, it was in its first 3 years of infancy, but by the 22 assessment, it was 6 years more established, and also the more extended duration of support. So everyone taking an assessment in 2022 could have been involved with the family hub from when they were born, whereas in 2017 to 2019, they would have only been involved in the family hubs for a more limited number of years. Do you want to the next slide, please, Mike? Yep. So the next piece of analysis we did was to consider whether there's a difference in the impact of family hubs on the two outcomes by levels of engagement. So for this, we considered the relative attainment of pupils who attended 3 or more times at events in Doncaster's family hubs by those who attended less than 3 events compared to their respective comparator samples. In this case, from pupils not resident in Doncaster, one of the statistical neighbours. I think it was quite surprising, actually. We found no statistical evidence with both groups. So if you attended 3 or more times or less than 3 times, you outperformed what you'd be expected to achieve compared to comparator. However, there was no difference in the amount in which you performed better than your comparator by whether you attended more or less events. We do think this is a bit surprising. We think it probably definitely deserved further research to understand it further, to understand different levels of engagement rather than a very crude 3+ or less than 3, but also to try and factor in the types of services which were attended. There's potential to do this with some of the data that Doncaster had. However, it would need quite a lot of work to categorise the different types of events. I think this is one area. There's lots of advantages for the work which we could do with the work that Doncaster had collected. However, to get more of a nuanced understanding is probably something we need to do to extend this further. And the final piece of analysis we did with the education data is to consider how the estimated impact of family hubs on the 2 education outcomes differed by pupil characteristics. So, for example, was the attainment of family hubs pupils with an SEND, so a special education learning disability, greater than what you'd expect for their matched comparator sample? Interesting, actually, given the findings from more widely, the analysis didn't only identified limited statistical evidence to suggest that attendance at the family hubs improved their pupil education outcomes for characteristics generally associated with lower levels of attainment. So if you had a SEND, whether you were eligible for free school meals, or if English was your first language, there's no evidence to say that, or very limited evidence to say that you outperformed what you would have expected to do if you hadn't attended a family hub. Whereas there was statistical evidence that pupils with the counter characteristics, for example, if you did not have a SEND, you weren't eligible for free school meals, you generally did do better than your comparator group. And what this suggests is that family hub services were not able to affect the disadvantage associated with these characteristics which we considered. And in the report, we're going to suggest that further research and work is needed to understand how the support provided by the family hubs does or does not can affect the support for pupils with specific needs. So whether there are particular groups with more disadvantaged characteristics who need further support as opposed to more generic levels of services. To the next slide, please, Mike. I'm now just going to ever so briefly consider some headline findings from the analysis of the survey data. So as I said, we did an evaluator survey which captured the views of a small number of parents and carers who take part in family hub services. And these revealed that perceptions of outcomes associated with involvement in the family hubs for themselves as well as their children. The responses revealed quite positive improvements for some outcomes. I think this was particularly related to kind of like parental mental health and well-being, and feeling that children were developing the kind of skills to be new skills and be more confident. But I think one thing that has to be said is that the numbers that took part in the survey are fairly low. So if some caution about generalising and being conclusive is definitely going to lead to wider outcomes. but there's definitely an indication that the Doncaster's family hubs are having a perceived positive impact in terms of mental health of parents and helping children and young people to become more confident. Excellent, Mike. Skip to the next slide, please, Mike. So I'm now going to move on to cost analysis. We've probably got the next one as well, actually, Mike. Thank you. Which is to provide some brief headlines from a cost analysis, which we did. The report includes a lot more detail. I think that it's probably quite important to read it to understand how the numbers have been derived and potential limitations. But however, I think if you look in the report, hopefully you'll find sufficient detail where you'll be able to apply some of the work which we've done to give an estimate for yourself and your authority about how much family hubs may cost and what the savings may be and how it compares to other services which you deliver. So I think it's probably, I'll provide headline findings, but I think if you use the report, you hopefully can use it to understand more about the costs of family hubs in your area or what it would be in your area. So the cost analysis considered the income sources that were used to fund the family hubs in Doncaster, Doncaster's costs of providing the family hubs, and then the average cost of the family hubs per member who attended, family, and per attendance at a family hub event. And it also looked at the average cost of family hubs per outcome, of the educational outcomes which we identified earlier on. And the evidence base for this was a cost survey which Doncaster completed as best as possible for the financial year 2021. I won't go too much into detail, but just to note that it includes quite a lot of the costs, the majority probably of the costs, income and expenditure, but it doesn't include everything. They weren't able to access external non-commissioned services. I think midwifery was a key one there. Also, in terms of expenditure, it wasn't possible to separate out expenditure which related to block contracts, for example, insurance, energy costs, and the council faced these as one block. It couldn't identify what percentage was on family hubs. Also, there were aspects of the family hubs which were just part of larger functions. For example, buildings maintenance. The council just dealt that as one big block against all of its activity, dealing with the maintenance of buildings, didn't have it isolated down to a family hub level. But hopefully, if you've got this data for your own authority, you can see what influence that may have on the figures presented. So in terms of a headline, I guess, with Doncaster's 12 family hubs in 21-22, their expenditure on them was just over £2 million, what we can identify. By far the majority of this, so 92%, related to staff costs. So it was very much a staff-heavy mode of delivery. Included approximately 73.5 full-time equivalent staff working in the family hubs on average. And it's obviously 12 family hubs as well. In terms of funding the family hubs themselves, 36% came from block grants, grant or block allocations, with 64% coming from the council's own financial commitments to the services that were being delivered out of it. So just comparing, just to give some indication of how the expenditure relates to attendance records, we were able to calculate the average cost per individual family hub member, which I identified to be £115, or roughly £256 per family member. So that's per family who attended the family hubs, which when you work out for the number of events that were at the family hubs in that particular year, works out around £20 per event. Obviously, some of the events would have been more expensive. Some of them would have been a lot cheaper. For example, like play activities might be fairly cheap, whereas activities which had a lot more staff involvement would have been a bit more expensive, but that was the average. Comparing the expenditure against the results from the impact analysis, we identified, so it's almost going back to how many additional pupils attained a good level of development or were working at the expected level. We identified that the average cost per additional pupil working at the expected level was just under £10,000, and the average expenditure per pupil who were assessed at working at the expected level in the phonics assessment was just under £22,000. So there's some useful figures, but hopefully provide some context and be useful to relate to your own expenditure and outcomes for your own local authority. You have the next slide. I think it might be back to you as well. Is it, Mike? Yeah.
Yeah, thanks, Ian. So just before I move on to some brief discussion around conclusions, I just wanted to point, as Ian was talking about potential learning for other local authorities from the report, I just wanted to point as well to the survey that Ian mentioned, which we just spend quite a lot of time in development, working with Doncaster and the wider team. That's actually there as an appendix in the report. So again, that might be helpful for you to have a look at that to see if the survey tool or some of the questions might be useful for you in terms of your own evaluation. Yeah, so overall, given what Ian said and the wider implementation and performance evaluation, the analysis shows, and taking into account the previous interim report, a range of evidence for these positive outcomes and by extension the system in the city. Now, with the methodology we used, it's not possible to be able to clearly associate the aspects of the model, and Ian's talked about some additional work that would need to be done with those outcomes. But there are issues which we wanted to point to, that there are indications that they may well have contributed. So first of all, the locality-based model, organising service delivery around large subdivisions within the borough, provides both efficiency in relation to organising staffing at a level above the individual family hub and sharing practice across areas. And it also provides flexibility, allowing variation, taking into account differences between localities. The second area is the core and extended offer, a clear offer aimed at families of under fives with a wider offer focused on older children and young carers seemed important. There are a set of key partnership roles explicitly aimed at enabling more efficient signposting and direct provision from the first point of contact, and an agile approach to change based on evidence of need in local areas, allowing services to adjust their offer as needs changed. There was clear senior support at service levels. We mentioned earlier this is a mature partnership, and that seems to engender and reinforce senior leader support, which obviously is crucial in any partnership-based approach. And a strong shared duty of care, staff at all levels and particularly frontline staff demonstrating and being seen to demonstrate care, compassion, knowledge and professionalism. And this in itself encouraged relationship building and trust, both with parents and families, but also across services. And finally, the alignment with wider strategic work and services in the city, dovetailing the offer with wider priorities and enabling efficiency. We mentioned earlier the locality-based model didn't just apply to the family hubs, it applied more broadly. And there were other examples of how the offer dovetailed together with wider activity. So that's the end of our presentation. I noticed there's some questions in the Q&A already. Hopefully we can get to some of those later on. I'm going to hand back now to Bronya.
Thanks so much, Mike and Ian, for that. That was really insightful. And yes, as you say, the questions are starting to come in already. But we're now going to move on to a presentation from colleagues from Ecorys, and we can pick up the questions later in our Q&A. Do keep putting them in the chat. So I'd now like to welcome Valdeep Gill, Associate Director at Ecorys, Panos Diodes, a Senior Impact Analyst, and James Whitley, who is a Senior Economist. A very warm welcome to you all. And we look forward to hearing your presentation.
Hi, everyone. Brenna, just check you can see my slides, right?
I can, yes. Thank
Perfect.
you.
Great. Hi, everyone. Really happy to be here and share some of the key findings from our evaluation. Some of the messages and key lessons learnt will be quite similar to the presentation that you've just heard from Sheffield about Doncaster Family Hubs, but hopefully it sort of just builds on the evidence. Our evaluation involved partnering with 5 local authorities that were spread across England, and they all had a unique family hub model, and they were all at various stages of implementing their family hubs and different stages of maturity. So they provided a real rich case study for the evaluation. Our study worked at 2 different levels. So we were looking across all 5 local authorities to build the national evidence base on what works in terms of family hubs, but we were also working with each local authority individually to provide lessons and evidence to each of those at that local bespoke level. Overall, similar to the Sheffield evaluation, we were looking at what supports for effective services, what outcomes and impacts are achieved for families, and also we were looking at the value for money achieved by the family hub models. Our evaluation had 6 key work streams. Today, we're going to be presenting key messages from the process evaluation findings. So I'll be sharing insights from workforces and families about the family hub models. My colleague Panos will then talk you through the impact evaluation findings, and my colleague James will talk you through the economic findings. And all of the findings are detailed in our interim and final reports, which are on the DFE website. So to kick off, I just wanted to give you a bit of a context about our 5 local authorities. They had all embarked on their journey to a family hub model prior to national guidance being available and also prior to national funding being available. They were all motivated by a need to improve the organisation and delivery of family services across their local authorities. They wanted to reduce fragmentation of services, make them easier to navigate for families and more accessible for families as well as creating more consistencies in the ways that different family workforces supported families. They had all developed local place-based models which built up from the strengths of their existing infrastructure across their early help services. A key message from our local authorities was that this was a whole system change project. So you really needed to bring in your wider partners across the local authority and outside of statutory services as well to inform the planning and the vision for family hubs and bring all your partners on that journey along with you. A key message also from our local authorities was that the transition process or that transformation journey can take a number of years. It's not something that can happen overnight. And it requires dedicated resource to keep that momentum going and to support that transformation over a number of years or over a longer period. So I'm going to just highlight some key messages around from the process evaluation before handing over to colleagues to present impact and economic findings. So first of all, from across our 5 local authorities, what worked in terms of creating more accessible services for families was firstly communicating the family hub offer to a range of multi-agency partners across the local authority to create a no wrong door approach. And something that local authorities were really clear on was that this wasn't a one-off activity. They had to repeat this offer and had to have an ongoing communication strategy to make sure that the family hub service offer remained front of mind for professionals. Communications really had to emphasise that services were for the whole family across the 0 to 19 age range. Families that we spoke to said that they still struggled in their local authorities to find the right help at the right time. But once they were referred into the family hubs, they reported generally having seamless onward referrals and getting the services that they needed. And other ways in which local authorities created accessible services are things that are now reflected in the national guidance, like having universal services, outreach and digital offers. And there were issues still in terms of accessing services and priority groups that our local authorities were looking to improve accessibility and engagement with. And so that is, again, just an ongoing process that family hub models and our local authorities were still working towards. Next, I just wanted to highlight how our local authorities reflected on that change process for different professionals and services. So having multidisciplinary teams was a real strength of our family hub models across all of the 5 local authorities. But something our local authorities were really clear on was that it doesn't just happen. You can't just bring a load of people together and hope they work together. It requires strong leadership. Co-location can help, but the thing that really made the difference to help different professionals and services to work effectively with one another was to create opportunities for them to actively work together. So whether it be through shared training, shared case management, shared reflective practice, those were the sorts of activities that helped different professionals to come together, see each other's specialisms, break down some of those cultural barriers that just happen in different professions, and support that workforce to start working together, both formally and informally. And a key message across all of our local authorities was that you really have to bring your staff along with you on that transformation journey, especially where staff feel maybe there's threats to their role, changes to their responsibility, the location that they're going to be working from. So that can really affect staff morale. So it's something that can't be underestimated. Next, I just wanted to touch on taking a relationship-centered practice. This was something that all of our local authorities were committed to and actually were doing prior to establishing family hubs in their local authorities. Most of our local authorities had invested in some form of shared or cross-workforce training to support a common practice amongst family hub workforces. Families told us that they felt safest to engage with professionals when they had a consistent key worker and had time to build up a trusting relationship. Peer support was a real strength of the family hub model and helped families to feel better connected with others in their community and to normalise some of the issues that they were facing. But something that was clear was that it needs to be supported and scaffolded by professionals, because it creates another opportunity for professionals to understand the communities they're serving, but also identification of further need as well. So those are just some headline findings from the process evaluation. I'm now going to hand over to my colleague Panos, who will talk you through the impact findings.
Thanks very much, Philippe, and thank you to the Anna Freud Center for inviting us. So I'm going to be briefly talking about the impact evaluation strand of this evaluation, starting by saying we follow a kind of similar quasi-experimental impact evaluation approach as Sheffield Hallam talked about. In our case, this was an area-based analysis, so we compared Essex against comparator local authorities and Leeds against comparator local authorities. So we focused our impact evaluation on those two kind of most mature family hub models. The actual impact evaluation method that we used was called synthetic control groups, and I can talk about that kind of method of analysis in the next slide. But first, I wanted to show you here what kind of indicators we used. In our case, we used publicly available administrative data sets. So we used, for example, the local authority interactive tool, the fingertips database from Public Health England, several different kind of data sets from ONS and the NHS outcome framework, and that kind of administrative data sets. The indicators that you see on the right-hand side, those are kind of the 15 indicators that we chose for Essex and Leeds. We try to match those as closely as possible to the intended outcomes for each of the local models. So, for example, for Essex, we knew there were sort of health appointments or referrals integrated within the family hubs. So we focused a little bit more on health outcomes, such as prevalence of obesity, for example. While in Leeds, we knew that there were more police staff integrated in family hubs. So there was a bit more of a focus on that. So, for example, the second one that you see on the right-hand side, rate of first-time entrance to the youth justice system, that was a pretty central indicator in our Leeds analysis. However, we do acknowledge that some of these indicators were not actually an exact match to family hub activity. We try to match them as closely as possible. However, some of those are obviously from administrative data sets at the local authority level. So this made impact attribution quite challenging in some cases. Next slide, please. Thank you. So in this slide, we're showing a few impact findings from Essex. So first of all, we found potential impact on two indicators in Essex when we compared Essex against this kind of weighted average of other comparator local authorities. And we found a statistically significant and positive difference on two of these indicators that you see here. the percentage of 3 to 4 year old children benefiting from funded early year education. In that case, we found a difference of 3 percentage points, and also the percentage of key stage 4 children going to or remaining in education or employment. In this case, the difference was a little bit smaller, 0.7, but it was statistically significant. And that's the one that you can see on your right-hand side in that graph. So just to briefly explain what we're seeing here in that graph and how the synthetic control groups method work, is that as we see, the blue line is the Essex trend. So that's the percentage of young people going to or remaining in education or employment. And the gray line, the gray dashed line that you can see, is our synthetic group, which is created out of other comparator local authorities. So we took all of this data from other comparator local authorities and we sort of grouped it together and weighted it in a statistical way so that we matched those outcome trends up until the point of 2017. 2017, as you can see that from the dashed line in the middle of the graph, that was the point where Family Hubs became live in Essex. So we use that as the sort of point of reference there. So the point of this method is that we can sort of match that outcome trend until that point, and then try to see whether there's a divergence between those two lines, which you can see in this graph very clearly that Essex outcome levels are actually quite higher than the gray synthetic control group, which means that if it wasn't for Family Hubs, that line would be sort of similar to that gray line. In this case, we had a challenge as this kind of indicator was actually performing quite highly already. So as you can see, this was increasing from 2013 all the way to 2017 and then kind of reaching a plateau. So this happened in a couple of different indicators, especially percentages that were above 90%, that were reaching those kind of ceiling effects, which is why we are seeing here 0.7 percentage points difference, which is not really that much. However, because it's already performing quite well, we didn't really expect to be detecting a really huge impact in that case. The other thing I wanted to mention here is that as part of this synthetic control groups analysis, we also conducted some validation checks, what we call placebo tests. In that case, we conducted those tests to basically make sure that the impact that we're seeing is in fact impact and it is attributable to the Family Hubs. And the way that worked is that we picked certain comparator local authorities and we treated them as if they had live and mature Family Hubs. So we compare those comparator local authorities versus other comparator local authorities so that we see what are the kind of outcome trends that we're detecting and what are the sort of differences between them. And if we find similar trends as Essex, then we know that there might be other issues with the data, some sort of noise picking from the data or other kind of interventions that we haven't adjusted for. As you can imagine, these kind of outcomes at the local authority level are pretty complicated and are affected by a certain number of factors. So that's why we conducted these placebo tests as well, to make sure that we can attribute those effects. And this is why we're saying here that this is potential impact, as we actually saw similar trends in other comparator local authorities, specifically some of the statistical neighbors of Essex. So that's why we think that perhaps attribution is not necessarily the correct word, but there is definitely some contribution to those kind of effects. Next slide, please. Thank you. So in this case, we're showing some impact findings from Leeds. In this case, we didn't really detect any statistically significant differences between Leeds and its synthetic control group. However, there were some really positive signs on specific indicators. As I talked before, the rate of first-time entry to the youth justice system, that is among children 10 to 17 years old, that rate we can see it decreasing steadily for the last 10 years since 2013. So that's a really, really positive outcome trend that we're seeing in Leeds. However, we didn't really see a sort of the same kind of divergence after 2019, after Leeds family hubs became live. We don't really see that kind of difference in the two lines, in the blue and the grey line, so that we can detect some impact that can be attributed solely to Leeds. Next slide, please. Okay, so some more positive signs on a couple of the different kind of indicators. As I talked about before, we had around 15 indicators in total across Essex and Leeds, and some of the indicators that we used actually to test impact were overlapping. We tested them both for Essex and Leeds. For example, indicators around social care. So in Essex, we saw the rate of children in need, which has been steadily decreasing after 2018. So that's after the introduction of family hubs. However, we didn't really see a statistically significant difference between Essex and synthetic controls, but the outcome trend is really positive. We also saw the percentages of pupils with special educational needs, as well as care leavers going to remaining in education or employment, which also has been steadily increasing since 2013. So that's another positive outcome that we're seeing in Essex. Again, these are not attributable to family hubs. However, these are very, very positive signs that we're seeing in key indicators, which are likely affected by family hubs. In Leeds, we saw also the reduction of re-referrals to children's social services. That dropped around 4 percentage points in the last 3 years. And we also saw a positive upward trend of 2-year-old children benefiting from funded early year education, which was supported by the Family Hub whole system approach to strengthen early help in the area, early help infrastructure in the area. It's worth noting that not all indicators showed a positive story, of course. Some of these indicators show that there is, in fact, room for improvement, and there are still a lot of different kind of indicators that the family hubs can impact in the future. For example, as we talked about before, in Essex, the prevalence of overweight and obese children, both in year 6 and in reception, that has actually been increasing since 2017. However, this is not solely happening in Essex. It's kind of consistent with other recent national trends across England, but it is one of these indicators that can definitely be affected by family hub activity in the future. So it's worth referencing here that this was one of the indicators that we saw that is kind of moving at a negative way, and is perhaps another kind of area of focus for the future. Right, I think that was all from the impact evaluation strand, so I'm going to hand over to my colleague James to speak about value for money.
Thanks, Panos. First thing to say is that there's no need to squint on some of the axes here. I will explain everything, but I did think it was useful to compare these bar charts on the same slide, so don't worry about that. I will explain everything. But yeah, this section outlines the value for money of the family hubs across 4 local authorities, so Essex, Leeds, Sefton and Suffolk. Bristol was also considered in the report, but its value could not be quantified due to its early stage of development. So what are the headlines from our study? So the 4 hubs have generated value of between roughly 37 to 68 million pounds, and the upper end of that, the 68 million, was calculated over the lifetime of a family hub, so that's 7 years. So you can see that in the top and the bottom bars. So the figures left to right add up to 68 million pounds. The lower end estimate, so that's 37 million, incorporates efficiencies over all years and the benefits from just year 1. So you can see that represented in the middle bar. And also, if you're particularly keenly eyed, you'll see that is the first 2 blue blocks in the top bar as well. Now, most of this comes from Essex. Now, does that mean Essex is the best? I'll do a number of value judgments in my presentation, but that's one value judgment that I won't do. Although declaring a conflict of interest, I do live in Leeds, so do draw from that what you will. What I will say, though, is that Essex started first, which probably reflects that. And also, obviously, all models, commissioning and local populations are different. So I wouldn't read too much into that, not least that this is an early snapshot. So if we were to redo this again with a bit more information, our findings could be quite different. Hopefully, obviously, more outcomes and more efficiencies. When we mention value, that's made up of two things. So first, in terms of efficiencies, so these are internal savings from the Family Hub, leading to more efficient ways of working. So that could be doing more with less, doing the same with less, or maybe even doing a bit less for a lot less. I can probably guess which category most local authorities fit into at the moment. So a few examples of those efficiencies that we're given. So for Essex, that could be improving or recommissioning services, integrating services or ways of working. In Sefton, we've got merging children's centres and family centres to form family wellbeing centres, and reducing building costs in Suffolk. So those efficiencies are represented in the dark blue blocks. So that's £30.7 million on the left of the screen. Now, most of that, like I said, is made up from Essex, so that's almost 29.4 million across its 7 years of operation. And you can also add to that £866,000 from Sefton and £435,000 from Suffolk in terms of efficiencies. So the thing with efficiencies, these are cashable, which basically means that these savings can, and in many cases have, been redeployed to deliver additional services. So you can really hang your hat on them. Much of this has already happened, and what hasn't yet is due to happen. So it's pretty certain, and that's why efficiencies have been included in our lower end estimate of £37 million of value. So that's efficiencies. The second element of value are benefits. So did a process called monetisation. So that's taking the impact from the impact evaluation that Panos has just presented on, and multiplying that by unit cost to estimate the value of those better outcomes, and adjusting for things like dead weight, so that's what would have happened anyway. Substitution, that's impact that's been transferred from other services, and also drop off. So in this context, that's the failure to realise some outcomes within a reasonable time frame. So the good news is the impact evaluation does adjust for this automatically. More generally, though, the benefits for these are forward-looking, non-cashable, and subject to much uncertainty. So that's why, in our approach, we've been conservative in our estimates. So you could probably tell that the dark blue sections being efficiencies, so it's all the other bars and sections that relate to the benefits. So in the top bar chart that you can see here, it's the value by year. So in year one, it's 5.9 million in blue, and that goes down to 4.8 million in red in year 7. So the fall in those figures from year 1 to year 7 represents discount in future years to account for uncertainty. Now in the middle and bottom bars, thereby different types of impacts that was found in the impact evaluation. So as you can see in purple, most of that comes from the key stage 4 destination outcome. So that goes from 5.7 million of value in year 1 up to 36.2 million in year 7. And that's followed in terms of magnitude by early years education in Burgundy. So that rises up to 1.1 million in year 7. Both of these are from Essex. And then Leeds is on the map in yellow due to its positive signs in terms of a small fall in first-time entrance to youth justice up to 0.2 million in year 7. Just a reminder that the impact evaluation describes Essex's key stage 4 and early years education benefits as potential benefits, and the youth justice in Leeds is positive signs, which again, as Panos said, reflects their uncertainty. Therefore, these benefits may or may not be realised in practice. So encouraging that chimes with some of the Sheffield Hallam presentation in terms of we encourage that these are measured in future, and there's some guidance in our report in terms of how that's done and some of the sources that are used. So we typically use the Greater Manchester Combined Authority unit cost database. So that would be one of the sources that we'd recommend. However, if these do occur in practice, the resulting cost savings could be substantial. And this is particularly the case if we've been conservative in our estimates with, for example, the benefits of free early years education estimated at £171 per year. Now, I can say as a parent of a 3-year-old and a 1-year-old, I can certainly say that I pay more than £171 per year for that service, probably more than that in a week, to be quite honest. Although I will say that the benefit there is not from early years education per se, it's from the free or funded element of early years education. So why have we gone for that estimate? Well, firstly, in terms of taking a conservative principle, and then also it allows us to use a consistent source throughout our analysis, that Greater Manchester source that I referred to before, which is really reputable and used across many studies and recommended by government. Another question you might have is, why is the Key Stage 4 outcome bigger than the other benefits? Well, Key Stage 4 destination obviously relates to employment, and employment could have many years of benefits over the longer term, and very diverse benefits, ranging from fiscal benefits to the exchequer, individual benefits in terms of payment and income in terms of spending, and also social benefits as well. I will say again, in terms of being conservative, that the particular unit cost is just related to the cost of needs and eats. So rather than years and years of benefits, which it could relate to, we've still been conservative in our approach there. And just to finish on from me, one thing to bear in mind is that it's been very difficult to distinguish the cost of the family hubs from what might be referred to as business as usual costs, i.e. the costs that would have occurred had the family hubs not happened. But the value for money analysis has been conducted on the basis of, and it would be fair to assume that in the absence of the family hubs, the cost of running similar services would have been broadly the same or even risen. That's me, thank you.
Thank you very much.
Thanks very much to all of you. That was brilliant. Thank you. We've got more questions coming into the Q&A. We've got a panel session before that, but please do either upvote other people's questions or add your own in there as well, and we will answer as many of them as possible. But before that, I'm delighted that we have a number of the local authorities who've been taking part in the evaluations joining us today. So I would like to welcome Lindsay Mortimer, Alison Fleetwood and Lisa Farrell. Lindsay is Service Delivery Manager at Leeds, Alison is Service Manager at Doncaster, and Lisa is Director of Operations at Essex. Welcome to you all.
Thank you, Bronya. We just thought it would be helpful to introduce our respective local authorities with some context. So in relation to Leeds, we are the second largest core city, and we have upwards of 178,000 children and young people currently in the city. We're a very diverse city, so we have some very affluent semi-rural villages, but we also have some of the most deprived inner city neighbourhoods in the country, and sometimes those are no more than a mile apart. We're a very ambitious, successful council. We have some very strong partnerships working with public and private sector and local businesses. And we have a strong track record of public service reform. So we were judged as outstanding by Ofsted in 2018 and 2022. Next slide, please. So in terms of our family, our early help hub model, we have 3 hubs currently that were set up to cover the whole of Leeds. So they were part of our Families First programme, which is known nationally as Supporting Families, and part of that wider agenda. The hubs aim to ensure a more integrated working and partnership model by working closely with our clusters, with schools, health and other services, to help ensure that appropriate support and help is individualised for every family through the hub offer. Each of our 3 hubs consists of an early help hub lead who oversees management of the team. We have early help practitioners, police officers, and we have specialist knowledge coordinators who have specialisms in mental health, substance use and domestic violence. Next slide, please. So in terms of our hubs, the aims were around supporting families to access the right services at the right time, supporting the continuous development of early help practice and the embedding of our Leeds practice model, supporting the analysis of emerging trends and themes within specific localities, and planning targeted community-based intervention to prevent needs from escalating and tailoring these really to the needs of individual communities. And they were also to support growth in knowledge and skill related to specific areas of concern experienced by families, particularly relating to alcohol and substance use, domestic abuse, adult mental health, and community safety issues. Next slide, please. So in terms of the findings from the evaluation, it has really supported us to think about the benefits of the hub model in Leeds. And what we found was that the hubs continuously address workforce development across the partnership, which is really positive in thinking around sustainability and upskilling the wider workforce on the basis that early help is everybody's business. The principles of early help are supported and valued by our senior leadership team and elected members, and that really drives our whole system approach. Hubs are seen as an extension of the front door, and that enables swift decisions to be made in relation to individuals. And that also includes some of our early help practitioners being co-located at our front door, but really linking in with our early help hubs. Our whole system approach addresses sustainability by building on and supporting the existing knowledge, skills and experience of a diverse workforce. So rather than just people referring into one place, we're sharing that knowledge and upskilling people across the partnership. The integration of the police has enabled and supported a focus on crime reduction, community safety and prevention, and we've heard some of the benefits of that in terms of first-time entrance to youth justice. The integrated, co-located, multidisciplinary working supports professionals better, which in turn supports families. And whilst challenging to work in an integrated way, I would stress the difference between integration and coordination. I think that is really key and is really part of our success as a Leeds hub model. The hubs are very much aligned to the Leeds Early Help strategy, and the hubs continuously reinforce the Leeds practice model and concept of one lead, one work, one plan, promoting a common language across the partnership and really preventing people from having to tell their story over and over again. The hubs apply the principles of restorative and relational practice and support the partnership by working with them, and that enables our restorative approach of high support and high challenge. It models good evidence-based practice and builds on what we know works, and by promoting whole family approaches, the hubs prevent silo working and the revolving door, ensuring that families get the right support from the right people at the right time. And I'm now going to hand over to Alison.
Hi everyone, so I'm from Doncaster. So I kind of feel like I'm repeating a little bit what Mike and Ian have already told you, but just a little bit of background. So we've delivered sort of the Children's Centre, Family Centre, now Family Hub model in Doncaster for a little over 20 years, but it's always been ever changing, ever evolving. When the old sort of short start children's centre models sort of disappeared, we decided to follow the APPG best practice guidance. The majority of our funding came from public health around the Healthy Child programme. So our family hub model was very focused around that sort of 0 to 5 age range, particularly the 0 to 2. A key aim was to narrow the gap and ensure all children have the opportunities to achieve their full potential. We've got 12 buildings and they are located in our areas of most deprivation across the borough. So we serve a mixed population. It's an old white British mining community. We have got a growing BAME population, which at the moment seems to just be based in the centre of Doncaster. They don't tend to be many of our BAME population on the outskirts of the city. We have a population of 0 to 5s of 17,233. 85% of these are members of our family hubs, and 35% of those that are members are accessing and engaging with our services regularly. We have an annual footfall of 123,946 visits across our 12 hubs across the year. Approximately 60% of children in Doncaster live in disadvantaged homes, with the deprivation being intergenerational. You could move on for me. So I've said a little bit already. So we reviewed the offer, we followed the APPG, and we wanted to make sure that we had a strengthened partnership response. So we linked with our other services, so our Families Information Service, our Early Help. The Young Carers was commissioned to be delivered within our Family Hub model. And we were also commissioned to run a pilot on the first 1001 days, sort of really focusing in on how we could make a difference in that first 0 to 2 year period. And that was based on co-located teams between the family hubs and midwifery and health visiting. And they did targeted, focused work on the most vulnerable families in one locality in Doncaster for a full period of 2 years. So they stayed with an allocated family for that whole 2 year period, and that had some really good outcomes in terms of the impact and the progress for those children. And we've now took the learning from that and embedded that into what is our model now under Start for Life. Next. It's always really interesting when I hear my colleagues Lindsay and Lisa talk, because I feel like you do the sort of, if we combined their offer and our offer, we'd have like a perfect Start for Life Family Hub model. So you'll see that Mike showed you the umbrella. That was our old model that we used to represent our Family Hub model. We've always been really strong on partnerships, but again, linking to what Lindsay said, we were partnerships working alongside each other. We didn't have that sort of integrated model. And I think after sort of seeing the presentations today and listening to colleagues, that links very much to my learning, which I'll talk about later in terms of the evidence and the data that was provided. I think we have a really unique model in Doncaster in the sense of that we've always retained our universal delivery for families. So we've always had that sort of early years provision and access and support for children and young people. So we've moved to this model really because what we wanted to do was sort of based on the Stable Homes Built on Love thing. We really wanted to start to evidence how it isn't about all of us as individual services under one umbrella working as individual services. It's about how that offer all comes together to support those families at the greatest opportunity with that strengthened partnership approach. So our key findings for me from being involved in this process, again, as was alluded to by Mike and Ian, the locality model's got many benefits. It really links to what Mike said around the compassion and care that was recognised across our partnerships. So what we do find is on that front line, because everyone works within a locality, they've really built up those strong networks, strong relationships, and it's a real place-based approach. So they really know those families, they know those communities, and they know the best way to sort of pull all of those different services together to support families. Again, similar to what Lindsay said, we've got real strong leadership buy-ins from our elected members, from our director, our assistant directors and our chief exec. That definitely helps us in a big way because we know that we've got that support and there's that confidence really in the impact and the difference that the Family Hub model can make for families. Evidence in quantifiable outcomes remains to be complex. I think we can all agree that it's really difficult to evidence the absence of something. I think our learning, particularly when we were working with Ian and trying to decide on what sort of data to provide and what that might look like, we were at the time of the evaluation, our sort of social care side of the help was based in a trust and not under the local authority, which provided some barriers in terms of accessing data and information. We're now moving where the trust is no more and it's come back into the local authority, and we're now looking at how we would sort of scaffold the information that we use, which is very much that sort of early intervention, early level sort of people just accessing play opportunities, parenting support, those sorts of things, with the other side of the world as well, and looking at what difference that might make to some of our impact and outcome data. Yeah, I think that's it. More work to be done. Like I've talked about data sharing, haven't I? And now we need to get better at that and get better at capturing that difference and what that looks like. I think that's me. Over to you, Lisa.
Thanks, Alison. So just to follow on from Leeds and Doncaster, Essex has a population of around 1.7 million and is relatively an affluent county, but has a number of pockets of high deprivation, particularly in the south and the north of the county. We have around 1,000 new births per month, and currently within the population around 85,000 of that 1.7 equates to 0 to 4-year-olds, with 235,000 from 4 to 19-year-olds, 120,000 children in primary school, and 80,000 in secondary school, which is covered by 520 schools across Essex. So in addition to the overall population, the Essex Child and Family Wellbeing Service also has a key area of work around supporting families, children and young people from priority groups, and therefore the profiling population is undertaken on an annual basis that identifies population groups within non-working households, traveller families, and those from other areas of vulnerability that could result in inequalities that children face. Next slide, please. So our Essex Family Hub model was implemented in 2017 and brought together 6 services that were previously separately commissioned, and they included the 0 to 5 Healthy Child Programme, the Healthy Schools Programme, the 5 to 19 Healthy Child Programme that consisted of school nursing, family nurse partnership, children's centres across Essex, and also Essex County Council took on a partnership with what was West Essex CCG, now known as Hearts and West Essex ICB, to form a partnership to also commission the West Essex Specialist Children's Community Health Services. Essex County Council commissioned this service out to a provider and was initially contracted to Virgin Care, who are now known as HCRG Care Group, in partnership with Barnardo's. And the Family Hub model consists of 12 family hubs, which are located 1 per district, with an additional 26 delivery and outreach sites across Essex. Part of the commissioning arrangement was to go on quite a transformation journey to move away from typical KPI indicators of commissioning and move to an outcomes-based contract, which was focused around 8 key themed areas that are then broken down into 22 individual outcomes. Next slide, please. So this is just a vision card that sets out what the Essex principles that were originally asked of us as part of the specification. And I'm not going to read this through in any detail as the slides are going to be shared. But ultimately, our Family Hub model was based on the principle of working towards family strengths in the first instance, focusing on preventing problems and achieving positive outcomes for children, young people and families. There was a key area around the ethnographic study that was undertaken as part of the commissioning arrangements right back in 2015, 2016. I identified Essex to be a very lonely place, and the commissioners asked us if there was anything that we was to achieve in Essex was to make people feel less lonely. So there's a real emphasis around building resilience of families, parents, and the assets that are already out within communities for them to be able to self-serve themselves. A large emphasis on working together across a whole system, building on evidence and being really clear and consistent about what we're aiming to achieve and what families want from the support that they are gaining. Next slide, please. So the evaluation findings for us in Essex really recognise the benefit and effectiveness of our data-driven approach. So as we are an outcomes-based model, there was a lot that we have done right from the start of the commissioning arrangement in 2017 to really build a database and information that demonstrates the impact that's being made and the outcomes that are being achieved. And that was really recognised throughout this research as a real benefit for us to be able to demonstrate the impact that has been made on a more local level. But as others have already reflected, it becomes more challenging to then be able to compare against national pictures or other family hub models when you are working and delivering family hubs in different ways. The integrated working across the partnership, there was a clear commitment to the same outcomes, there being flexibility in how they are achieved, and also whether it was our service or part of the wider system, so that families did not feel the need to keep repeating themselves or telling their story more than once. And that was really reflected within the parent feedback that we received as well. As Baldeep mentioned, there was some feedback that we had identified around families describing not knowing where to seek the right help. And this feeds into some of the recommendations that we'll go on to about the learning that we've taken from this research, in that once families had accessed the Family Hub and received support, generally they felt really supported and they knew how to access support going forward. But that initial interaction is the area that we needed to look at of how do we better engage or ensure the families understand what they are accessing. And that through the integrated team and the partnership between HCRG Care Group and Barnardo's, there was a real opportunity for colleagues and staff to have continuous learning and skills through competency through the integration, and that particularly ex-children's centre members of staff felt they'd adjusted and gained a much more breadth and wider confidence in being able to support families from working with colleagues such as health. So what we're just going to move on to shortly now, before we move into the wider Q&A panel, is the conclusions and key considerations that were found as part of the research. Is just that Alison, Lindsay and I are going to share some key factors around what the learning we've taken from that and how has that impacted or changed our Family Hub models or our arrangements within our local authorities since then. So I don't know, Lindsay or Alison, if you want to kick off or you want
yeah, I'm
perfect.
Happy to start. I think it's important to say that when the evaluation was ongoing, Leeds were in the kind of beginning on a journey of reviewing our early help, as lots of local authorities have. And what the conclusions and considerations have done is really confirm that we were on the right track and that the kinds of things we were thinking about that needed to happen, that there is an evidence base for that. So I suppose some examples of that are around meeting the demand for SEND within services. So we know that there are increased numbers of children and young people who present with additional needs, and having the resource to be able to meet those needs is really key to providing that holistic support for families. And that will be embedded in our new family and community hubs, from which we're taking the learning in terms of what we've done in relation to our early help hubs, but we're moving, more with the kind of national focus around what family and community hubs need to deliver. I think also in terms of thinking around the range and the quality of universal and community-based provision, I think it's really key to think about a hub and spoke model and how those partnerships work. Integration is really key in terms of that multidisciplinary approach. And whilst you can do that to a degree, there are obviously many, many more services around children and families that you need to be working with, and those teams around the family, that communication is really key. So moving towards more of a hub and spoke model, so not just relying on family and community hubs, but really working on those partnerships and making sure there are those teams around families. One of the real benefits to Leeds is our Leeds practice model, and we're very fortunate to have had the investment of an implementation team to really drive the Leeds practice model. And I would say for anybody interested in that, I'm more than happy to be contacted. But I think for practice, that has been really key in building on the strengths-based approaches, family-led decision-making, advocacy, and also having consistent language and consistent tools in terms of engaging families has been really positive. Lisa or Alison, do you want to come in?
Yeah, thanks, Lindsay. So I think just following on from what Lindsay said, there was a key emphasis, I think, for SEND services probably throughout the full research. And I think certainly for us within Essex, there was a key area around that front door, and also the understanding of families that's also mentioned in the practice section around as our family hubs in Essex, the buildings are called family hubs. That also meant that understanding around accessibility often meant that people needed to physically come into a building to always access those services. And it wasn't also about all of the community outreach and the work that's being delivered by the system. And so by promoting an element around one single front door, that families needed to understand that they didn't need to physically come into the building to be able to access that. And it could have been via the digital platform. It could be through accessing your local toddler group. And so there's been a real key emphasis that we've needed to look at in terms of families, partners, understanding around what equates to the family hub, and it not just being the provision that's provided by HCRG, Care Group and Barnardo's, but also wider within the Essex system, and those partnerships that we have within the community are also contributing to a family hub model. So there's a lot around people's understanding and reflecting back to what the Ecorys colleagues shared as well, is that it takes time. So families still will know service professionals as a health visitor or as a school nurse, and what they associate their previous engagement and relationships with. And so introducing new language, new words, new titles to certain roles to be able to create a family hub model takes a long time for parents to associate those things to a family hub model. And so it's about consistency. It's about having a really strong comms approach with that, so that you build that brand and understanding that when families access something, that they see that as a contribution to a family hub, even if it might be called a stay and play session, or it might be called a new birth visit by a health visitor. It's an understanding that they're still accessing a hub model in that way. Alison, anything you want to add?
I feel like I've already said it really, but I just think from my perspective, it's definitely that integration. I think we've got a really strong family hub model that's based on those sort of pivotal 0 to 2, 0 to 5 years. And then alongside that, we've got a really strong early years inclusion team. We have an SEM provision that's got Ofsted Outstanding and that's won the Nursery World Preschool of the Year award. We've got a really strong MASH offer, really strong early help offer. Our learning from this process has been that we've seen those as MASH, early years inclusion, early help. And when we've talked about family hubs, we've thought very sort of closed in our sense of what we see as the family hub delivery being what happens from the building. We're definitely thinking much broader now, looking wider than that, and really recognising that that family hub offer is what everybody and anybody within your local authority is doing to support those children and families. And it's about how do we get that shared language? How do we recognise that we are celebrating what everyone's doing? We're not in competition with each other. And how are we capturing that data in a way where everybody can access that and use that to inform sort of service planning and service delivery to make the best difference for families?
That's brilliant. Thanks everyone for sharing those insights. I'd like to welcome back all of our speakers, and we have a couple of additional panel members as well, I think. Some of the questions have already been addressed in the Q&A, so thanks to all of our panelists for doing that in the background. I'd like to focus on the two that are currently outstanding. The first one was for Lindsay, Lisa and Alison. This came in from Mitch. He said, have you managed to embed a common needs assets assessment tool such as CAF amongst all professionals? And if so, what were the challenges in implementation?
I'm happy to come in from a Leeds perspective. We have, or as I would say, we're in the process of doing that. We have something like 70,000 people in the city of Leeds working with children and families. So as you can imagine, you never quite get to the point where you've shared that message with everybody. So it's a constant work in progress. However, we have utilised our Leeds practice model, and specifically formulation, which some people might know as 6Ps, which is essentially our assessment tool. And the benefit of our implementation team is that they can constantly revisit and reinforce what formulation looks like, how to undertake it, what the benefits are for families and professionals, and ultimately you have a shared language. And families are really familiar now, so that they're not having lots of different people assess them in different ways. So whether it's social work or whether it's early help, even in youth justice, everybody is familiar with formulation.
So I'm happy to come in from an Essex perspective. So within Essex, we have adopted to the shared family assessment, which is a shared family assessment that is utilised across Essex and incorporates part of the Essex Children's Strategic Plan for Children. So it's the same form of assessment that's used within our Strengthening Families approach and also our children's social care. But in addition to that, it incorporates the elements around an initial health assessment. So as our contract is also commissioned to provide public health, we utilise the initial health assessment as part of the Healthy Child programme with the aspects around the strength-based approach of a shared family assessment. And so part of core training, induction, competencies, it's all kind of incorporated into training and sign off to ensure that all staff and colleagues that are working within Essex are signed up to the same form of assessment. But equally, it shapes the form of kind of tasks, and as Lindsay has said, it's consistently utilised as a one form of assessment that's utilised across the system within Essex to embed that learning, understanding and that strengths-based approach in assessing families, regardless of the service or agency that they may be accessing.
Fantastic, thank you. And Alison, I wonder if this might be a question for you. It's come in to say that in Doncaster, 85% membership rate of 0 to 5s is really impressive. Who takes the lead on getting families to become members, and how long did it take to embed this into standard practice?
I would say that our absolute sort of golden egg that helps us with that is that we have 96% of our midwifery appointments operating from within our family hubs. The only ones that don't operate in our family hubs is those that need to be overseen by a consultant, so they're seen within the local hospital. And we've got a couple of anomalies in certain areas where the clinics just happen within health areas rather than within our hubs. But yeah, 96% of our midwifery appointments happen in our hubs. What that enables us to do is that rather than us having to rely on those partners to remember to do that alongside everything else that they've got to remember within that sort of short period of time that they've got for those appointments, whilst those families are waiting in that reception area, we call them business support officers, but they're really not business support officers, they're customer service. They will sort of have those really sort of important dynamic conversations with those families. They'll get them signed up as members, and they'll also share all of the other information that they need around what services are available to support families. That's definitely our biggest thing that I would say for anybody. If you can achieve that in your areas, that's where you'll really sort of get that sort of take up from families. We do see quite high levels of engagement. Our engagement tends to drop off around about age 3, but then when you look at our funded access data, we've got sort of 97% of our 3 to 4 year olds accessing their funded entitlement. So we don't see that as necessarily a negative thing because we know where those children are.
Brilliant, thanks Alison, and thank you to everyone. That's been a really informative session. We're coming to the end now. It's coming up to 11:30, so I just want to confirm that we will be sharing the slides. We're sharing links to the reports so you can read more, and we will circulate the answers to the questions that you've put in the chat. But I just want to say a massive big thank you to all of our speakers for a really interesting session, and thanks to our audience as well for being really engaged and submitting your questions. Thanks to our amazing training team behind the scenes who've been working really hard on making sure everything went smoothly this morning. And thanks also to my National Centre for Family colleagues, National Centre for Family Hubs colleagues who've helped out this morning. So yeah, please do read the evaluation reports for further insights and see our website for a summary. And you will be directed to a survey form at the end of the webinar. So please do fill that out. We appreciate your feedback. And obviously you can book onto our upcoming learning events and sign up to our newsletter if you want to know more. So thank you very much and see you again soon.